Okay, so let's have a look at the fibula. Okay, and the fibula forms the lateral aspect of the lower leg. So let's just pick up some tools so we can start discussing this. So we've got the fibula, and that forms the lateral aspect or the lateral bone of the lower leg. Now, the upper aspect, or the most proximal aspect of the fibula, is known as the head of the fibula. And the uppermost point of the head of the fibula forms a prominent process known as the styloid process. Now, the head of the fibula is generally cylindrical in shape, and it bears an articular surface. And that articular surface is on the most medial aspect of the head of the fibula, where it forms a junction or a joint with a similar articular surface on the lateral aspect of the lateral condyle of the tibia. So we have a small joint in there. Remember that this area in here contains the interosseous membrane. Okay. Now the actual shaft of the fibula is triangular in shape. So the shaft is generally triangular in shape. And it has a prominent interosseous border. Which runs from the articular area of the lateral malleolus all the way up to the articular area on the head of the fibula. So this becomes the interosseous border. Now the fibula itself also has a medial crest, which arises posterior to the medial border and ends at the medial side of the head of the fibula. Now distally, the fibula becomes the lateral malleolus. So let me just get rid of those a moment. Done. Ooh, sorry, let's just get rid of those. Clear pen. And let's come down the shaft of the fibula. Okay, and again, as I said, the distal end of the fibula becomes the lateral malleolus. And again, there's an articular surface on the medial aspect of the lateral malleolus, this remaining the interosseous border. Okay. The head of the fibula is again palpable, and so is the lateral malleolus. Interestingly, some fractures of the ankle may also correspond with a fracture just below the head of the fibula. So, depending on the mechanism of injury and the symptoms presented by the patient, the referring clinician may ask for imaging of both the ankle and of the knee, because as I said, sometimes injuries around the ankle can be associated with corresponding injuries of the head of the fibula and the area just below the head of the fibula, the sort of neck of the fibula. Okay, and that's because this kind of forms almost a ring bone, if you like. So if we just clear that a moment, and if I just take some of the magnification off here so we can see the bone all together, I pick up my pen in a sense, this almost forms a kind of ring bone association. So if you get fractures in the ankle, they can sometimes be associated with fractures up here, just below the head of the fibula, almost in this sort of neck region, neck of the fibula there. Okay. And that is the fibula.